Depression and anxiety and sleep issues are a big symptom of PCOS. If you're chronically tired, you're having trouble sleeping all the time and then not feeling refreshed when you wake up, that's an issue. We have a lot of women too that they do sleep a lot and they're still not feeling refreshed. A big part of the PCOS and our hormone optimization in general is thyroid optimization, because the screening test that we are taught as primary care providers isn't the best to finding out how well your thyroid is actually. Our main focus here at Wellness is weight loss, but that also goes into PCOS. So that's what we're doing our big Black Friday thing on. So I'm Angela Mineo. I'm a nurse practitioner and I opened Cheval Wellness in the spring of 2023. I used to work for the conventional or the traditional primary care practice, and I got really burnt out with the insurance companies controlling everything we did. So I decided to open up my own clinic last year, and it's doing really well. We really focus on helping women with hormone optimization and weight loss, because those go hand in hand a lot of the time. But we're in the Newport Richey area, Newport Richey Trinity.
Nice. So you're super close to me. You're probably like 15 minutes away.
Nice. Yeah.
Can you explain what the weight loss with the PCOS have to do? Because I never heard that.
Yes. PCOS, it's polycystic ovarian syndrome. It actually affects about 1 in 10 women. We found a lot of women that have had the symptoms for a long time and just never got diagnosed with it. We do a really comprehensive lab panel and then also a questionnaire. We go over all their symptoms. We get a lot of data to be able to figure out what's going on. PCOS, even though it's usually you have cysts on your ovaries, but that's not always required because they can come and go throughout your cycle, so they're not always seen. But it is a issue with androgen, which is testosterone, the male hormone. It makes women extra sensitive to testosterone because of insulin resistance, which means that your body's not taking the insulin into the cells that it needs to function properly. So insulin is just hanging out in your veins and arteries and not being used. That insulin resistance, it's what causes the issue with the testosterone sensitivity and what causes a lot of the effects that we see with PCOS, like the facial hair, acne, abdominal weight gain. Weight loss helps with the insulin resistance in general, so any weight loss helps with it, but also the medication that we use frequently for weight loss, like the injectable medications, the GLP-1s, like Semaglutide, like Ozempic, Wegovy, and tirzepatide, like Mounjaro, those help with the insulin resistance and weight loss as well. Those are pretty integral to some of our clients' PCOS treatment plan. When you're able to fix the insulin resistance, it fixes a lot of the testosterone sensitivity and a lot of the symptoms that come with it, including like infertility. It can also, if it's not treated, put you at a higher risk of diabetes and heart disease. And actually, women with PCOS are at a higher risk of ovarian cancer as well. We have to be proactive and prevent a lot of those issues too.
I feel like most of us don't know the basics of what we should know to take care of ourselves. There's a line where this is just okay, a normal part of life, a normal part of my cycle versus, oh, this is not okay, I need to go. And I often say that we have almost glorified pain, like no pain, no gain, or like we just accept and welcome pain without questioning it. What should we know? When do we know that we need an extra support?
Yeah, I do feel like we kind of put up with suffering more. That was one of the reasons I started Cheval Wellness. Women in general, I was guilty of this too as primary care with my conventional education. For menopausal symptoms, they just tell you the only options are synthetic and you really shouldn't be on those long, so you don't even offer them. So when I would have women come in with symptoms, I wouldn't really be able to help them much either. We've just been kind of conditioned to be ignored, but it's really the symptoms that are chronic, not ones that are just there for a few days. That might be more like PMS or PMDD, but things that are bothering you long term. Depression and anxiety and sleep issues are a big symptom of PCOS. If you're chronically tired, you're having trouble sleeping all the time and then not feeling refreshed when you wake up, that's an issue. We have a lot of women too that they do sleep a lot and they're still not feeling refreshed. A big part of the PCOS and our hormone optimization in general is thyroid optimization, because the screening test that we are taught as primary care providers isn't the best to finding out how well your thyroid is actually working. That just tells us like how your brain is talking to your thyroid. Fixing or optimizing thyroid can make a huge difference. but it's really symptoms that are decreasing your weight, your ability to function and your quality of life. Libido, really bad fatigue, joint pain. Like I've had so many women tell me, oh, it's just because I'm getting older. It's not true unless you're like 80, 90. Random aches all over isn't normal unless you have a diagnosed autoimmune or rheumatology issue. I think so much of it just gets brushed off as it's normal aging, and most of it might be common, but it's not necessarily normal and not necessarily something that we have to put up with.
Yeah, I like that. We confuse common with that's part of
Normal.
life. When I see clients who are starting to deal with their diagnosis, often they may have infertility issues, they have pain, they don't know how to communicate. I'm not able to have sex now because it's so painful. Often I come in the part of reclaiming pleasure, like, yeah, I already went to therapy, I already did all this, but I have been so caught up from this that I just don't know how to rediscover my sexual pleasure now. They have been through a lot of years of being gaslighted like other providers.
Mm-hmm.
How do you help them move through getting diagnosed, getting to treatment, actually following their treatment? I'm not sure if your type of work is like you come to the clinic and they do everything in the clinic, or do they need to do some homework?
Yeah, no, so like if they come in for our hormone optimization program, we do the blood work here. We do a very extensive panel. Like regular cash price would be like $1,600 if you had to pay it cash. We do a really extensive panel, which most primary care doctors don't do because they're limited by what insurance will cover. We don't have to worry about that because we don't accept insurance. We have our own negotiated cash rates for labs. So we do a really extensive panel. We also have a really extensive questionnaire to go over like their medical history and their symptoms to figure out what's going on with them. We sit down with them for an hour and go over all of their symptoms, their questionnaire, their labs. I explain lab by lab what they mean, what our preferred ranges are, because we don't go by the lab conventional ranges, because that's just, the average of everybody walking around. That's not necessarily the best numbers for you to feel your best. We go over all of the optimal functional ranges and kind of educate as much as we can, because I feel like a lot of it is education and we're kind of ignored most of the time. So women, it's kind of sometimes hard to educate them and make them see that there's another way other than just what your primary care doctor or even your gynecologist says. Because I know a lot of gynecologists just want to put women on birth control, which has its own issues, which it's great. It's fine if you want it for the birth control, but just to treat, PCOS symptoms, it's not the greatest. We use a natural micronized progesterone that's plant-based, so it doesn't have all of the side effects of the synthetic progesterone. So we get it compounded, so it's even better absorbed than the commercial version. A lot of it is just educating women how we can do things differently and they can work better for most women, and trying to get them to really invest in their health instead of just depending on their PCP and their insurance to provide everything for them. Most of the time, I would say maybe 80% of the time, they won't cover what they really need to treat it unless you're okay with the synthetic birth controls, which, like I said, can cause a whole number of issues with those as well.
Do they need to change anything in their lifestyle when it comes to PCOS? Like, does your life day-to-day need to change?
Yeah, so PCOS, since you usually have some form of insulin resistance, we usually recommend a lower carb, high protein diet to help, and usually cutting out grains is a big thing because a lot of times you have some inflammation that's contributing to it as well. And a lot of grains are very inflammatory. So we go over all of the lifestyle changes as well to help with those issues.
I found that many people who struggle with chronic pain or chronic conditions have been in a hunt for finding what's happening for years. How do you see this type of clients, and how do you help them?
I've had a lot of women that they've been told that's just like something they got to live with, like chronic knee pain. I'm 38, but I've had chronic knee pain for probably 10 years. Nobody could figure out why. I had all the testing done. There was nothing wrong with me. So they just had me taking ibuprofen every day, which isn't good for you. And then I checked my testosterone level and it was in the tank. It was very low. Once I started the testosterone optimization, all of my unexplained joint pain went away. It's really life-changing. I didn't even think that would be a thing when I was trying it. I just wanted my libido improved. I got a couple of benefits in addition to that. Lots of women start testosterone for their libido or their fatigue. And they find out there, and one lady, she's like, I can squat for my job and it doesn't hurt anymore. She was really amazed by that. That's more like perimenopause, menopausal. Younger women can be low testosterone, but the PCOS are usually more like they have more testosterone or they're more sensitive to it, so it's not as much of an issue. Our testosterone can start decreasing in our 30s and we can lose up to 50% a year. So it just depends on you and your body how fast that goes, but that can be an issue. A lot of people hear AT and they think it's just for perimenopause or menopause. You don't have to be going through menopause to benefit from it.
Do you work with women only, or is it non-genderized?
We offer for men, we take care of men. So we're trying for this next year to focus on women because that's just where my passion is. We've been ignored and kind of gaslit for so long. I really like helping women feel better. It's a great feeling to know that their lives are changing, feeling better when they've been ignored and or treated wrong, like been given the wrong treatment for years. So that's what we're focusing on.
This may be like a very bad quality joke, but women often go to the gynecologist and complain about some pain in the vulva and they like brush off. But if men go to the urologist, when I have sex, my pain really hurts. They will blow, like, we need to fix it, we need to figure out what's happening. Like, that wouldn't be taken as, oh yeah, it's normal. You know?
Yeah. Well, it's the same for like libido. You know, how many drugs do we have for men's libido now for ED? There's so many of them. And women, they're still trying to find the right one. Like they still don't have a good one out for that commercially wise. There are some peptides that help with it that are from compounding pharmacies. They're not FDA approved, but they still work well. But the FDA approving Viagra and Cialis and everything before we have any help for women is sad.
I mean, we're still defending our right to feel sexual desire.
Yeah, body autonomy.
In terms of PCOS, how does healing look like? Like, what does that mean? Does it go away? Does it just improve?
For our PCOS ladies, we treat them, we optimize their thyroid and their progesterone and the insulin resistance. Usually they start feeling better within a month, but for some it takes a little bit longer to find the good dosage for them because we don't want to go too hard right away, like too much medication or hormones right away. So we start it low and titrate up monthly. So usually ask them to give it about 3 months. But the progesterone optimization, unfortunately, they're usually really deficient. So it's kind of a lifelong thing, especially if they want to get pregnant. If they have issues with fertility, that's definitely something they have to continue. If they do get pregnant while they're on it, they do have to continue it because that's what helps maintain a pregnancy is the progesterone level. Thyroid might be improved with lifestyle changes and there might be some supplements. If we can get the inflammation under control, that might be improved with that. Insulin resistance, that's something that you can eventually wean off of. Once you can make the lifestyle changes, we use the medication to help you lose weight and help with the insulin resistance. If you're able to maintain those changes, that is something that you can maintain on your own after that.
Do you help them with fertility too, or do you figure out?
I like our treatment for PCOS, and we also have a treatment for Hashimoto's that helps with fertility. But once a woman becomes pregnant, they do have to go be seen by a obstetrician. With my certification, I'm not able to manage pregnant women. I can help them get pregnant, and then after that, we'd have to refer them to a obstetrician.
Now, you mentioned Hashimoto's. Do you have specific chronic conditions you specialize in?
Our hormone optimization program for women really encompasses everything. With our comprehensive lab panel, we check a full thyroid panel, all the sex hormones, estrogen, progesterone, testosterone. We check iron. We check for pre-diabetes, like the insulin level, vitamin B12, vitamin D, basically everything that can encompass the hormone symptoms that we usually see. And those things that we check, we manage as much as we can here. I do find women with Hashimoto's, so it's not optimal, and we get them started on optimization up to the highest level and their numbers aren't coming up, then we'll check them for Hashimoto's. And if that number is positive, then we do have a protocol for that. That's usually, eliminating inflammatory foods, and there's a natural anti-inflammatory that we use. It's just basically anything that falls under the hormone umbrella, and Hashimoto's definitely falls under that.
Do you ever reach out to people who maybe they're not struggling with any conditions, they just want to make sure that they're good, like that all the boxes are checked, or if there's something they can do now to maybe prevent anything else from developing?
Yeah, I mean, any woman can come in for our hormone optimization, like initial consult. It's $299, and it's all that entire lab panel I was talking about, and the 1 hour consult to go over everything. just to make sure everything's on the right track, even if you don't have symptoms. You don't necessarily have to continue with our program. We have a lot of ladies that just come in for the initial consult to see where they're at and what changes they might need to make.
I feel like many of us, like especially when you're very niche, you're just repeating yourself over and over again. Like, what are those things for you?
The big one is the thyroid, just because I get so many women, they're like, oh, my doctor already checked my thyroid, it's fine. So I'm like, okay, well, I can look up your old labs and see if they really checked the whole panel. If they didn't, I explain how just that one TSH isn't enough to tell us your full thyroid health. If they do have the whole panel checked, their primary care is just going by the conventional lab levels. So I have to talk about the different levels and how those aren't always the best for us too. That's probably my biggest, the one I have to explain the most, is about thyroid health. Primary care doctors are not trained. I've taken a lot of advanced training outside of my education to learn more about how to properly improve my treatment of hormone. I did a bunch of advanced hormone training to be able to provide better care for people, because our conventional education just doesn't teach us very much about it. We go through the lab panel that we do, because we have a cash price with LabCourse. We just go through the labs, and the thyroid's one of the top one. Like the TSH can be normal, and then we check a free T3. So if the free T3, we like that one closer to 4. We treat anybody less than 3.5 if they have symptoms, which is like getting cold easily, fatigue, the joint pain, constipation, brain fog. Even if you don't have clinical hypothyroidism, which means your TSH is elevated, the free T3 is a conversion issue. Your body's supposed to convert the T4 to 3. So if it's not converting well, then that can mean that you just need some optimization with the T3 itself. We've just found a lot of women aren't converting it as well as they should. So any woman that's less than 3.5, usually if you're less than 3, you're having one of the symptoms, fatigue or getting cold easy. So yeah, we go through all of that. And we also have all of the basic labs we go over, but most people's basic labs are fine. Their glucose is normal, because that insulin that we check, the fasting insulin, is a lot more sensitive. It picks up the insulin resistance better than your glucose level, because we also check like an A1C. So we just go through everything one by one and explain it all. It would take an hour.
It's interesting that you said that most people's general labs are fine. Like, so basically, superficially, everything looks okay. My approach is to explore sex from like the emotional and psychological side, but we cannot make up for hormones. But then if you're going to a regular physician, then they're not doing a full panel. There may still be something we just don't know, but we think we already did that.
Yes. Yeah, exactly. I get so many women, because I used to do a lot of events out in the community, and so many women are like, my doctor checked my labs, I'm fine. And I'm like, well, did they check your testosterone? No, they didn't. Well, did they check a T3? No. So insurance only wants to cover the bare necessities. So they only check, like the CBC, the CMP, a TSH, and a cholesterol. Most of the time, those are normal for, I would say, probably 95% of the women that are in our program. Their basic labs were normal. We had to dig deeper to find the reason for their symptoms. My testosterone was low. No doctor had ever thought of checking that. I was diagnosed with, periodic limb movement disorder. I wasn't sleeping through the night. My limbs were moving and waking me up subconsciously, and I didn't know it. I was sleeping 14 hours a day. The doctors couldn't figure out what was wrong with me. The basic blood work looked fine. They put me on stimulants just to keep me awake, and I was like, that doesn't fix the core issue. What's causing it? I wasn't anemic, so they didn't worry about anemia, but then I myself checked my ferritin level, and that was really low. So that is our short-term iron stores. If that's low, that can cause those issues too. I got an iron infusion, and a lot of those symptoms improved. I wasn't sleeping 12 hours a day. My iron itself and my hemoglobin was normal. I wasn't anemic. It was my ferritin that was low, and that can cause issues, but it's usually not looked at unless you're anemic. So it's tough.
What will be your top recommendations for people who want to improve their sex life?
Check your testosterone level. If it's not at the top of the range, so like 40, 50, most women I see, it's in the single digits or teens. We definitely want to optimize that. So in our treatment program, like with our testosterone, we do pellets and cream for women. Our goal for them is 150 to 200, because that's usually where women feel the best. We've only had 2 women that once they were optimized, they were still having trouble with their libido. And we have those peptides I was talking about that work really well. So I would just make sure your testosterone's optimized. Of course, there's, like you were saying, emotional, psychological, other issues that come into play. But if all of those are good and you're still having issues, then I would definitely look into your labs and see what can be improved there.
Also, the other way around, if your hormones are out of whack, you may not feel that great emotionally either.
Yeah, low testosterone it causes so many issues with women. That's the other thing too. When you go for HRT, gynecologists usually, there are some that are checking testosterone, which is nice, but most of the time they only check your estrogen level and like an FSH, because that tells us if you're going to menopause. But estrogen is only one part of your hormones. Testosterone plays a huge part in our hormones, our sex life, our bone health, heart health. It's protective against breast cancers. It's really sad that one part is left out a lot of the time with hormone replacement, HRT, when you go to a gynecologist or PCP for it. Unfortunately, testosterone treatment for women itself isn't approved commercially for women yet. Of course, it's approved for men. That's another thing. It's good for men, but they haven't done it for women yet. But there is a real diagnosis, hypoactive sexual desire disorder for women, and the treatment is testosterone, but it's not commercially FDA or available for women in the United States. So that's why we have to go with compounding pharmacies that'll compound the medication for us at the lower dose that women need and not the super high dose for men. I went off on a tangent there, but yeah, I wish that was included more with HRT. It makes such a big difference. But if your testosterone level is low, it can cause irritability, depression, and anxiety. Like me, just improving my testosterone level has helped a lot with my mood. I used to get very irritable all the time. My husband would testify to that. It's made a big difference, the testosterone optimization.
Don't feel sorry about tangents. I love tangents. I feel like that's where the juice is. Who are the professionals you usually refer out to?
We do most things here in-house. We have somebody we refer out to for like gut health, because I'm not super knowledgeable in that area. I can do like bloating. I have some hormone options, but apart from that, I send them to somebody else. We have a personal trainer that we refer people to, because a lot of the things, especially like PCOS, is just getting moving, and that helps a lot with your metabolism. We have an esthetician that I refer to, and she refers to me, just because a lot of times, like PCOS, you battle me. We can help with that. I have a psychiatry nurse practitioner that I refer a lot of people to that need more help than I'm able to provide. We also offer primary care, so I can manage basic, mild depression, mild anxiety. But after that, I really prefer for a professional that has their certification in that to manage them. Those are the big ones.
What's going on for business right now?
Right now, the total transformation package is semaglutide. It's a 14 weeks semaglutide, and you basically get the first month free. It also comes with amino acid mix injections that help with metabolism, prevent the side effects from the semaglutide, and helps you maintain muscle. It comes with a session with the personal trainer that we refer to. You get a scale that connects to our site to monitor your weight weekly, with weekly check-ins. You sit down with me for the hour when you get started to go over our orientation, and we get all your numbers, your weight, your body fat percentage, because we want to make sure you're not losing muscle in the process.
I've heard a lot of semaglutide like recently.
Yeah, they've been using it under Ozempic for diabetics for about 12 years now. It worked really well for diabetics, and then they found that they were losing weight with it. It works on the appetite hormone in your brain and insulin resistance. In the last few years, it's been FDA approved for weight loss under Wegovy. So that's why it's really taken off, because now a lot of people are using it for weight loss. Unfortunately, insurance doesn't like paying for it unless you're diabetic. Most of the time, there are a few good insurances that'll cover it for weight loss, but most of them you have to be diabetic. And it's also in very short supply. While it's on short supply, we're able to get it compounded through a compounding pharmacy, the generic version of it. So we're able to provide it at a more affordable price for those that their insurance doesn't cover it. It works very well for weight loss. It's not fast. You don't really want fast weight loss for it to be safe. It needs to be slow and steady, right? So we say about 20% of weight loss in about 6 months. It works really well. They're looking into using it for inflammatory issues. We have one client that's using it. It's eliminated his Crohn's flare-ups. It's helped with PCOS symptoms because a lot of PCOS is related to inflammation as well. So we're just exploring other ways to use it as well because it is working. It's pretty remarkable in how it works and reduces inflammation all around.
That's pretty cool. I've never heard that before. It's cool to know.
I'm excited to see what else they use it for in the future because we found it helps people cut down on drinking. It kind of just turns your taste buds off. You just have no desire to drink for a lot of people. So I think they're looking into using it for addictive disorders as well. So it'll be exciting.
Any other words you would like to leave people with?
Make sure that your doctor is listening to you and taking you seriously. Here at Cheval Wellness, our tagline is making your healthcare more personal, creating a plan for you, not a cookie cutter plan that they use for everybody, and really diving deep into your labs and not going necessarily by the lab value ranges. It can be really hard to find. I don't know of any doctors that take insurance that do that because you take so long with that you really can't. The insurance reimbursement doesn't cover the hour that you want to spend with somebody. So it really limits you to 15 minutes with a person. So that's one of the reasons we decided not to take insurance because it would really limit the amount of time we could spend with people. I know everybody wants to use their insurance, but it's not always the way to get the best treatment. A lot of times you have to go outside the insurance system and to find what the best treatment that'll work for you.
Well, thank you so much for taking this time to share. I'm glad to see you.
We do offer free intro consults if somebody just wants, or assessments, if somebody wants to speak with me for a few minutes to see if we can help them. We do offer those appointments on our website. Our website is Cheval, CHEVAL wellness.com. Anybody can text or call us if they prefer. Our number is 813-776-5751.
Thank you so much.
Thank you for having me.